Today's guest is a lifelong lover and solver of puzzles and problems. He loves the complexities of data and real-world impact. But can the AI chatbots from his company, Hyro, solve patient frustrations in interacting with the healthcare system? That's a tall order. Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, senior advisor at Walgreens.
Well, today's guest is Israel Krush, co-founder of Hyro, whose mission is to revolutionize conversational AI. Meanwhile, join the fast-growing CareTalk community on LinkedIn, where you can dig deep into healthcare business and policy topics, access CareTalk content, and interact with the hosts and our guests or their chatbots. And please be sure to leave us a rating on Apple or Spotify while you're at it.
So, David, why are we talking about chatbots, and how does it relate to healthcare?
You know, I was intrigued when I was reading about Israel's company, and he had he founded a company. We know he's a scholar because he founded a company with hypotheses, which is something we would love to do. And it was really about chatbots and voice assistants being the future of human-computer interaction, and the traditional ways of doing it were no good. That was back in 2018. We're in 2024 now, so I want to know, how's it panned out?
Yeah, absolutely. So you're right. I think that when we started the company, we had two hypotheses. One is that natural language interfaces, so chatbots and voice AI assistants, will be the dominant interfaces when it comes to human-computer interaction. I think that today, with the buzz around ChatGPT and large language models, it's a matter of time. Of course, we're going to talk with technology. Of course, we're going to type into technology, and the technology, computers, phones, would be able to understand us in our own human language. So this hypothesis today, I think, is less of an hypothesis. This is a reality. With regards to large enterprises in the healthcare ecosystem, but generally speaking, adapting chatbots and voice AI assistants and being able to deploy and maintain them, that's the second hypothesis. We believe it's going to be very hard for them to do so. And I think that you see that even post the buzz, we're 18 months now after, call it the media attention that we got with the release of ChatGPT, and you still see very few production-ready, patient-facing or end-user-facing chatbots and voice assistants that are available. So the hurdles to actually deploy and maintain those are still very hard, and that's exactly what we try to simplify and help with this transition.
So, Israel, if you think about the consumer approach of whether it's claims or answering basic questions, chatbots are not only increasingly more pervasive, in some cases they're more sympathetic than the actual people on the phones. And yet there have been real hurdles and roadblocks and sort of a high level of concern about engaging directly with patients around clinical issues. What's the big difference? Language is language, knowledge is knowledge. What's different?
So, yeah, absolutely. To your first comment, John, chatbots or voice AI assistants, they never get tired. They never get frustrated. They can speak with you 24/7 whenever you call them, and they'll have the same tone, and they can be empathetic these days also with some new tech. To your point, what's the question? Even before getting into clinical use cases, let's just talk about administrative use cases within healthcare. I think one of the main things to consider here is the cost of mistake. Let's think about a chatbot that helps you buy, clothes, t-shirts. If you requested the blue t-shirt,
David buys a lot of t-shirts.
Yeah. Okay, you see, so here's a user for you. So if you request a blue t-shirt and you get a purple one, you might be upset, but it's not the end of the world. The cost of mistake is not that big. Now,
also, Israel, by the way, John is colorblind, so he really doesn't care what shirt shows up.
I'd be fine.
I'm as well. By the way, 1 out of 7 males is colorblind. So.
It tends to be associated with higher intelligence, David.
Sorry.
Exactly. 1 out of 250 women, by the way. So
anyway, yeah. So I'm going to be upset with my purple shirt, but I'm not going to be upset if they take out my kidney instead of my liver. Am I?
Correct. No, absolutely correct. Maybe this is, a very extreme example, but even scheduling an appointment in a time slot that doesn't exist and you getting into the clinic to find out that it's closed and the physician that you wanted isn't there. That's like much more frustrating and opens a lot of lawsuits against the healthcare facility. So the cost of mistake is probably like one big factor of why you don't see them a lot in production these days.
So, I mean, I get, these voice bots, they don't get tired, but also what happens is sometimes they try to be empathetic and they'll say, say your whatever, and I'll say it, and they say, could you say it again? Or, please say this. Yeah. And it's like, oh, I'm sorry, I can't understand. It's like, shut up. And at the same time, I do find that the ChatGPT is it can be very empathetic. And in fact, the bar relative to like a healthcare administrator or a doctor isn't that high. So it can easily be more empathetic than them. Does it end up playing a role? Can it play a role in, personalizing care and actually improving engagement? These possibilities?
Well, David, maybe the way to think about it in Israel, to frame it a little bit more broadly, the large language models, which kind of drive ChatGPT, maybe you could kind of explain what they are and how they feed ChatGPT to sort of contextualize David's question.
Yeah, absolutely. So large language models, at least today, are very much statistical tools. So they don't have deep reasoning as we as humans have. So when you ask me a question, I actually think about what I want to answer to you, versus like a large language model will think about what's the next word in the highest probability. And all of a sudden, because it was trained on so much data, we got like to this magical point in which the sentences makes a lot of sense.
Yeah.
And then to your point, we can align them to be sympathetic, and we can align them to not break certain rules. And I think that while reading these answers or hearing these answers, it all makes sense. There's a big hallucination issues with them today. We talked about cost of mistake. So the AI will sound smart and sympathetic and will schedule an appointment for you, but with a physician that doesn't even exist. And that's a problem. Yeah. So it doesn't know.
So what's the difference between David's hallucination and ChatGPT's hallucination? Like, how do you define it?
It's a good question. I think that I don't know, like regarding David's hallucinations, but to give you like a good analogy with human beings is like a 6-year-old. When you ask a 6-year-old to do something, some of it would be based on ground truth, and sometimes the 6-year-old would be shy to say, you know what, I just don't know. So we'll make up something. And that's how you need to think about it with large language models. They don't know that they lie. Actually, if you continue the conversation and say, you know what, this physician is actually not existent, or like this appointment is not in their schedule, they will apologize and say, you know what, you're actually correct. So,
that's very different than David. David never apologizes.
So how do you deal? So the hallucinations are a problem, and you talk about Hyro controlling hallucinations. Do you just put the thing in a headlock, or what does it mean to control the hallucinations?
Yeah, absolutely. So in healthcare, we talked about the cost of mistake. And I think another thing that we didn't talk about is the fact that this is a regulated industry, a very much highly regulated industry, which is part of why the cost of mistake is so big. So now I'd say the new buzzword, especially in regulated industries that want to deploy AI, is responsible AI, or in our area, responsible conversational AI. And I think that, I'm allergic to buzzwords. So I like to say, what does it mean for me? And when I think about responsible conversational AI, I think about 3 main pillars, which are explainability, control, and compliance. So explainability, why the AI replied the answer that it replied. And again, without getting too geeky, large language models are large machine learning models, which are large black boxes. Inputs, outputs, you don't really understand what's happening inside. So how can we make it more explainable to why did I recommend this physician? Why did I give you this information about your headache, and so on and so forth. And it's not like that's partially to deal with the hallucinations issues. And it's not like you can eliminate it entirely, but you can definitely offer citations and paths to how the AI deduct the answer. Control to your question is, how do I balance between the generation, Gen AI, generative AI. So how do I balance between the AI generating an answer to, this is a sensitive subject. I don't want you, dear AI, to generate an answer. I want you to give me the same exact response each and every time. The simplest example here is when you are in an emergency intent. So when we identify that you need like to get to the ER or call 911, we don't want the AI to offer any type of treatment or diagnosis besides telling you, it looks like it's an emergency situation, call 911 or get to the ER.
So Israel, is the right way to think about this, because OpenAI has continued the organization that's behind ChatGPT that is the way David and I are navigating the world of not necessarily telling everybody using these models to answer questions or to prepare work, have been somewhat allergic to actually limiting what's effectively a feral model, a model that is learning even on the questions that you're asking. Anthropic has a different competitor has worked to sort of organize and try to make more explainable the way the way the models are driving answers. It's just two different approaches to a similar problem. ChatGPT is more open-ended and has obviously got more users. I think what I hear you saying in healthcare is, rather than let the models try to answer every question in every place, you're actually putting stops, controls, and effectively guardrails that no, you can't answer certain of these questions because the range of answers is too risky to risk the wrong answer. Is that the right way to think about it?
Absolutely. We actually talk about guardrails or safeguards in terms of, like today there are a lot of AI companies. Some of them are basically, let's call OpenAI or Anthropic or any other large language models. In healthcare, you just cannot do that. So the question is, what are your guardrails? For example, we use a knowledge graph. Again, without getting too geeky, what we do is we can tap into the physician directory and scrape all of the physician's information and restructure it in a knowledge graph form. And then when I have questions about the physician, I know that the large language model isn't going to go to the World Wide Web and search for the data, but is going to search it through the knowledge graph. So the knowledge graph will work with in tandem with the large language model. And that's how you create a guardrail.
Just to be clear, a knowledge graph would be a form of a database, only a little bit more elaborate with a few more pathways. But it's a data structure that
Correct.
you vetted and manage, so that therefore it's safer. Is that the right way to think about it?
Absolutely. And we reorganized it in a way that you can think. So let's take a find a physician use case. So the main entity in this knowledge graph would be the physician, and some of the attributes of this physician would be their specialty, the insurance plans that they accept, the locations they accept in, and you can actually visualize all of this information. So when I'll say, I'm looking for a cardiologist to speak Spanish and accepts Aetna insurance in the Upper East Side, I'll see John as a physician that is a cardiologist that accepts Aetna and is in the Upper East Side and whatever else I said. But that's how you guard the data. So you won't make up physicians just to satisfy an answer.
There is a John Driscoll who I think it's a pediatrician on the Upper East Side, but I never could have gotten into medical school, unlike David.
Yeah, I'm sure that I could have gotten in. I don't know what I would have done once I got inside there. Though, look, I have a brother that does that. Now, speaking of John and not John Driscoll, there was another John that you spoke with recently, John Brownstein, and I saw you had a webinar on responsible AI. And John was actually been a guest on our show, and I don't know whether he's responsible or not, but he is a creative thinker. What
he's responsible. We love John, and please don't forget to re-listen to that podcast.
That was a good one, John. He's always smiles through whatever we say to him, kind of like you, Israel, in a sense. Whatever we throw at him. What was that webinar like? Any takeaways from that on the responsible AI side from John or others?
Yeah, I think that John and Boston Children's like are very thoughtful and very advanced with everything that they do with large language models, with their collaboration with OpenAI. I definitely don't think that you should take an example from John because they're very advanced in terms of like the resources that they can put in. And I think that the nice thing about the conversations with him, and obviously that's not our first conversation, is the depth in which they actually started experimenting with large language models for a variety of things. Now, I said don't take an example from him because it's really where we started. It still is a hustle to deploy and maintain good enough chatbots and voice assistants for various needs, especially in a patient-facing setting. So unless you have the time, the research says, both from a capital perspective and from a technical perspective, to actually get very much into the weeds, you probably want some sort of a partner to help you navigate that. And I think that Boston Children's is in a very unique place to be able to both find the partners, but also do a lot of experimentations by themselves.
So we're fortunate enough to actually live down the street from Boston Children's, and my kids have gone there. And one of the things and we've done some work there, and one of the things that struck me is that what AI, but also other sort of technology should be able to do is enable anybody, wherever they are, even if they're not just down the street, but to be able to tap into that kind of expertise and to be able to project it further. You see people there from all over the world. There's only a few that can come. It's very expensive. You have to wait, etc. But how can we tap into all of that knowledge, not just randomly that's generated, but actually that they've generated, and bring it forth? Hasn't happened so much to date. Does AI, that wasn't necessarily the conversation with John, but does AI enable that to a greater extent, or is that a different direction?
Yeah, I think that as AI matures, it's going to be, the most professional, skilled workers, knowledge workers that we've had. That means that they can query various large databases and return with coherent answers and really create efficiencies and more access to care, access to knowledge, generally speaking. So in healthcare, which is a very complicated area for a lot of us patients, to grasp, both from, the clinical side, but also in terms of how it works, the payers versus the providers versus the pharma companies. It is still very problematic to navigate.
But Israel, I do think that David's asking a slightly different question, which I've actually seen some evidence, David, that there is. I mean, there's an MD who's a chief data officer in a hospital who's got a very rare form of cancer, and he's actually using the hallucinations, those sort of probabilistic jumps in the model, to help test whether new forms of and new combinations of cancer treatments might help accelerate his healing. And because he's a PhD in data science as well as an MD, and understands that he can, to Israel's point, control it. But I do think that in addition to learning faster, which I think was your question, we also may be able to tune some of these, what now is a hallucination, and potentially control them, as Israel's suggesting, into insights. And maybe we'll try to get that doctor on our podcast. But I think it's a really, it's a subtle question. And I think Israel, I mean, you've got to speak to this, but I think we're still figuring out the models. But there's a lot of runway.
No, absolutely. I think that if we're looking at this from this perspective is, when people thought about what are the first use cases that AI is going to solve, I can tell you that the last use case that people thought that AI is going to solve is creativity. And all of a sudden, most of us on our personal use ChatGPT for creative thinking, right? Like it helps us brainstorm, it helps us come up with questions, it helps us come up with workshops that we want to have with our leadership teams, and so on and so forth. So to your point, I definitely think that it's not necessarily like hallucinations, it's like even a mutation to genetic algorithms, like that's part of how we as humans evolved. And it looks like there is a subpart of algorithms called genetic algorithms that uses this mechanism to actually come up with new novel solutions. So where can it go? I don't know yet. And I don't want to guess because it seems like our guesses in the past were very wrong, but it can definitely help us achieve, I'd say, like breakthroughs that we weren't even thinking about.
So last question. We've been fairly positive here about AI as a good force. And on the other hand, we've seen that some nurses in particular have been raising the alarm bell over the use of AI and the introduction of AI. We actually did a popular show on it. I think it was one of our highest rated episodes about that. What is your take, Israel, on why at least some nurses may be kind of raising the alarm and even taking labor action when they see AI being introduced?
Yeah, absolutely. So it's not only nurses. You heard about the nurses, but so we sell voice AI assistants, right? What do you think the call center manager thinks about that, or the call center agents? And I think that generally speaking, every time that a new technology wave, a big technology wave, like a platform shift is happening, there's a question of, is it going to eliminate a lot of jobs and what it's going to do to these populations? And I think that what we've discovered in the past is that while it's eliminating some jobs, it creates a lot of new ones. So I can end it in an optimistic manner, but because you requested a pessimistic one, then I will also share that the pace in the change of pace that we're experiencing with AI is unlike anything that we've seen in the past. So the concerning factor is, are we as humans going to be fast enough to adapt to the change that AI brings, given like the technological breakthroughs that are happening really every week? And in the past, we had enough time, like with the, again, internet, cloud, mobile, as a platform shifts, we were able to adapt to it because it took like several decades. Now it's going to take less than half a decade to see a lot of implications of AI. So that's the question. Like, will the human race be fast enough to adapt to this new pace of technological shift in the era of AI?
Excellent question to end on. And I was going to ask another one about whether podcasts can be replaced with AI, but we'll save that for another
We're
episode.
Podcasters.
Yeah, exactly. We can't do that. Well, that's it for yet another episode of CareTalk. We've been talking today with Israel Krush. He's co-founder of Hyro, revolutionizing conversational AI. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, senior advisor at Walgreens. If you like what you heard or you didn't, we'd love you to subscribe on your favorite service. And thank you, Israel, for joining us.